as COVID cases in the city of Toronto don't seem to be decreasing. The city shifts into full gear in administering vaccines. Eagle News correspondent Yolanda Asprias with the details.
This week, the City of Toronto is on full vaccine rollout with opening more mass immunization clinics, mobile and pop-up clinics throughout the city. As of Wednesday, more than 800,000 doses of the COVID-19 vaccine have been administered in the city. Let's listen to Mayor Tory.
More than 800,000 COVID-19 vaccine doses have now been administered in the City of Toronto. We are the first health region anywhere in Canada to administer more than 800,000 doses. Vancouver, for example, has administered more than 270,000 doses, while Montreal has done more than 567,000 doses. But we still have much more to get done. I am determined with my colleagues to make sure that we continue to vaccinate as many residents as supply allows. And I'm determined, just as I know Prime Minister Trudeau and Premier Ford are, to get more and more vaccine supply.
Last week, the city announced that it would be switching the focus to vaccinating people and essential workers who live in neighborhoods that are considered a hotspot. However, there is a concern that some who don't live in these hotspot regions may be traveling to these areas to book themselves and get the vaccine. Here is what Dr. Davila has to say.
People have to make their own decisions around their health care, and in fact, we see this not only with vaccine, we see this with health care across the board. People often live on the border of one jurisdiction and the next, and sometimes the closest health care clinic is actually one that is technically outside of the jurisdiction in which they live. I think we have to trust that people are making good choices and taking advantage of vaccine as their turn comes up to receive the vaccine. But of course, we're also really encouraging people and hoping that people do respect that stay-at-home order and abide by it to the maximum extent possible, recognizing that getting necessary health care would be one exception.
Dr. Davila also addresses the issues surrounding vaccine supply, as reports of some community vaccine clinics closures have been reported this week.
I think fundamentally what we have here, though, is an issue of supply. As Chief Pegg has provided, we are only, stocking our clinics with just enough vaccine to see us through until the next delivery. And I think we are all suffering as a result of a delay in arrival of vaccine. There were vaccines that were anticipated to arrive on a certain date. Unfortunately, that date was missed. And as a result, we have a crunch on vaccine availability. I think the good news here is that there's interest in our population in receiving vaccine, and it's our most fervent wish to be able to provide those vaccines to individuals who want that vaccine as soon as is possible.
The Scarborough Health Network confirms Wednesday that 2 of their clinics at Centenary Hospital and Centennial College will be temporarily closing due to vaccine supply. Take a listen. Our vaccine clinic teams are contacting everyone whose vaccination appointment is impacted by this closure, and we will help people reschedule their appointments at the next available opportunity. We know that this is very disappointing to families across Scarborough. We will reopen our clinics as soon as we receive more vaccines. Toronto reported 1,332 new COVID-19 cases Wednesday, with 90 hospitalizations and 8 deaths. In Toronto, Yolanda Aspiras, Eagle News. We live in interesting times.